welcome to the Hit Like a Girl podcast. I'm Joy Rios, and today I'm talking with Eden Brownell. She's the engagement specialist at mPulse and an expert in behavioral science, user design, and public health. Her work helps healthcare organizations adjust their efforts to meet the health needs, confidence levels, and cultural sensitivities in meaningful ways for their patients, essentially reimagining health engagement for the modern age. Let's hear what she's got to say.
My name is Eden Brownell, and I am an engagement strategist at mPulse Mobile, which is sort of like what does that mean? On my team, I'm more considered like our lead behavioral strategist, so I really nerd out on all things behavioral science and psychology marketing, and really trying to understand the member and their perspective and things like that to really tailor communications and outreach and solution design to really how do we change behavior and motivate members. So it's super fun.
Well, so if I understand a little bit about the service that mPulse provides, it's a lot of around patient engagement, right? And kind of meeting them where they are. Can you talk to me a little bit about how mPulse engages differently with patients than maybe what has been done in the past?
Yeah. So even myself, I've worked across sort of like a lot of different channels and IVR in my past role, and we still do some IVR here, and there's email, but really I think where we focus and what's a little bit of a change for me that I really loved is doing more of SMS communications. And I think that's really relevant to the meeting members where they are, because no one likes to answer phone calls anymore. Everyone probably has, 1,000 unread messages in their inbox. And with our SMS technology, we're able to have not even just, sort of like a one-way message or simple two-way communications. We're also sort of pushing the limits and using natural language processing and ARs that are happening in the background to really respond to members, even if they go, we sort like off script. So, but it's things we plan for. So we know that, we're trying to get members to get important screenings or their breast cancer, appointment or something like that. We understand that there's a whole bunch of other things going on in their environment that could be getting in the way. And so we're constantly listening for that type of feedback. And then we have developed in the background responses specific to those. And what we do also is we're constantly analyzing those reports and sort of the members' different statements that they might come back. And if we see something that's happening a lot, that's not necessarily one we caught for, we'll go and create it and build it back in the system. So I think that's really nice, where we're trying to personalize it to, what we're seeing on a whole and, what the research says. And that we're also able to update it and make sure it's reflecting sort of the current, especially when COVID happened, we came up with all sorts of automatic replies around COVID and concerns and things like that. So our system could constantly listen and respond to, whatever was top of mind for the member.
I just got an interesting patient notification, literally like within the last 24 hours from my healthcare system. And it was a phone call that left a message, but then my message turns into a text. So it came over as an email that I could see the phone number that they wanted me to call. And then they said I had a notification waiting for me. So then I literally just like a few minutes ago, called, heard the notification, and it was a recorded voice. It sounded like of a doctor who was telling me why it's more important to get my flu shot now more than ever. And, if I needed the resources for any of that. And I just thought, I don't know, there's a lot of different ways that you can communicate with people, but it seems that it worked out pretty well because it was on my time. I didn't answer the phone call when I called, but it's been maybe like 24, 48 hours since I got the call. And now I'm like, all right, I feel up to date. So is that something that you guys do too?
Yeah, that's super relevant. So what we try to do is we try to come up with like preferred time of days for members or preferred communication channels. But like you said, like we might still be in your window, but like you're driving or you're, people are picking up their kids or there's stuff going on. So allowing that, like you said, to sort of pick up on like the journey at your own convenience. And so we do that a lot of sort of delivering messages and then trying to make the if we leave like a voicemail that will go to text and stuff, make it as engaging as possible, make sure we're leaving the number so when it does come through, like you said, as sort of a text, it's clickable. And then we leave that open, that line open as long as possible so folks can dial back in at a time that's best for them. So definitely in our wheelhouse.
Well, I thought it was really effective because they even said like this message will be available to you for the next 3 weeks and then it's going to disappear after that. And I thought, well, okay, I better call because
Yeah.
whatever they're going to tell me. But when things come through SMS, if somebody responds back, it sounds like it's not necessarily just a yes or no. Are they engaging in a conversation with the
Yeah.
sender? Right.
Yeah, so it ranges on the type of program we're deploying. So it can be simple yes nos. We can have number responses. We and then for more of the automatic replies that are built in the background, someone can say, I don't have a ride to my doctor, and it'll click into our sort of transportation benefits that are personalized from the client specific to the member. They could say cost and we'll have something specific to that. And then we really try to steer clear of simple yes nos, only because when given an option to say no, people are going to do it. And we try to really breadcrumbs someone deeper into the conversation rather than just allowing them sort of a quick exit. Again, you can just not respond. So there's always that. There's always the ability for members to unsubscribe. And sort of in our messaging, we make sure that we really talk around choice, and we know that autonomy is a huge thing. So really letting members steer their own journey in a bit of a way.
Well, and I would imagine that if you have a lot of tasks that maybe somebody needs to accomplish, just giving them one at a time is a little bit helpful so people don't either become overwhelmed or they can just like accomplish a little bit of what they need to get them on their way to their journey.
Yeah, exactly. And there's so much research around that and like how you can sort of, build their self-efficacy and their confidence and their motivation. If you sort of break it up more like that. If we, I don't even know. I'll get overwhelmed if I get a notification that it's like I'm due for the screening and I have an annual wellness visit. I'm like, even those two are a lot. So we really try to be mindful of, sort of cognitive overload and doing as much when it comes to like our health plans. They're trying to accomplish a lot, especially right now we're in midst of gap closure season, and they have HEDIS measures and everything that they're trying to reach, and we just try to be really mindful and sort of really represent the member's perspective when we're designing with our clients. And if you're going to have multiple screenings or things that a member is going to be eligible for, we want to prioritize them. So if we can just again start with one, let's try to get accomplished, let's follow them through the journey, let's help them, assist them. And really, if we have members that are more high risk, either because they have multiple open gaps, or we also do an SDOH analysis, so we might see that they're in a high impact area where where we already know that cost or transportation can be a concern. At those times, we really try to prioritize the client's resources to actually get them to like a care manager or someone on their team that can really have a deeper dive with the member and sort of coordinate multiple levels of care, opposed to if just us trying to get them to do 5 or 6 things. So sometimes, we understand that not all of our clients can have resources for their giant population. So how do we really try to, more break those out by risk so that those highest risk members can still get the help that they need?
Seems like it's a pretty needed service. I'm sure that your clients are really grateful for everything that you do for them. What did you study in order to get into like this kind of work?
Yeah, I have a bit of a funky background. I did my undergrad I actually started in theater of all places, which is very random, but I think it was because I really liked studying the characters. I quickly switched though and realized that that was because I loved studying people. So I ended up doing my undergrad in psychology, sociology, and anthropology. I at first thought I wanted to be like a child therapist and work in more of like a one-on-one setting. And I did that for about a year and a half, and realized I was too close and went home crying a lot. So I have such respect for people, but I still wanted to work in healthcare and helping people. But I was like, oh, what do I do in my life now? And I had to sort of go back, talk to my mentors, look at my network, and I discovered public health, which wasn't a degree for me like as an undergrad. Now it is for undergrad, but not at the time. More things coming up and getting made all the time. And so I did it in I live in Boston, so I actually went to BU for their public health program, and I did a focus in social and behavioral sciences and health technology. And then I do a lot. My team calls me the team nerd, because I am always in books and I am trying to find courses online, a lot with behavioral economics and behavioral science, and its application to healthcare is so new. So a lot of it is just finding resources as they become available and trying to stay really in the know as it comes along. So
Yeah.
I went all over.
Have there been any resources that stand out to you that have just been like, I don't know, allowed you to totally geek out that you're like, oh, everybody should know this.
Yeah, I can't speak, I can't give it enough credit. Irrational Labs, they have a behavior design course that's I think about 8 weeks. You can kind of do it on your own time. They have check-ins with some of the team over at Irrational Labs, and they're a huge behavioral science team there. And they also recently came out with one that's focused on application to healthcare. So that was really great. I loved just the examples they had, and a lot of it wasn't just constantly things being thrown at you. There was a lot of like, sort of worksheets and activities, and time for you to really think of your own use cases and how you can apply the principles. So I really loved that one.
That's great. Well, what are some of the most effective ways to change behavior? I mean, we've talked to quite a few. Like that's a big deal, right? For getting
Yeah.
somebody to have one action and just make a different decision. From going forward, now you're going to do something different. Like, what have you learned, or I don't know, what have you
Yeah.
there?
So I think I think anyone that's sort of practicing in this area will have their, sort of different answers, because people are so varied. I have ranged from using things like health belief model to more now with behavioral economics and behavioral science, there's a lot more research around biases and things like and heuristics and things that are sort of we know to be true about most of the population. So I gravitate towards like some of the models, especially where we're dealing at a population level, that are focused on more of a population. So like I love self-determination theory. I think it's what I tell a lot of folks about. And I've done a lot of we had a recent conference, and our clients are always very interested in how do they apply it to all their other marketing and things that we're not working on. So I always feel like self-determination theory is one of the best. There's three main principles in it. It's autonomy, competence, and relatedness, and it's sort of under this umbrella of we as humans all have these basic needs, and it comes down to those three. So autonomy is like we like to have choice and control in all of our actions, or that feeling. And then relatedness is you want to connect with others, and not feel, I'll get that one. And then confidence is, you want to feel like confident and you have the skills to do something. So it's, using that in messages is can be as simple as, many other members, managing this condition are using these type of processes. You're not alone in this. You have some choices around the way you deal with your diet. Here's some tips and tricks to build the self-efficacy. And just those things I think are just like inherently, like I said, about all humans. So they are great motivators for uh, all realms of behavior change.
I like that. I don't think I'm pretty confident that I haven't studied that before specifically, but it's easy to remember. So, and I definitely relate to it, the idea of autonomy, relatedness, and getting confidence. I think I'm going to incorporate that into whatever I do from now on. Thank you.
Yeah, it's such a good one, and like you said, easy to remember. There's it sort of all of the behavior change models that come out are constantly building and borrowing from past ones. So you see a lot of the same ideas come up, and so I really like uh self-determination theory, because I feel like when you look at a bunch of the different techniques, it really boils it down in a nice way that's like, oh, like these are in so many, and it's really straightforward and not overcomplicated, because I think some of them can be like models and this and algorithms, and sometimes you're dealing with people and you need to just have like empathy first.
So, Eden, can you tell me what 10-year-old Eden would think about what you do for a living? Like, did 10-year-old Eden have any idea that you'd be doing what you're doing now?
Oh man, she would have no idea. She wanted to be a lawyer and I was obsessed with Harvard, and like I was like my own little like Rory from Gilmore Girls. I just was like, I'm going to Harvard, I'm doing it, I'm gonna get there. And I just like then I like joined a debate thing, and all these other, and I was like, no, I don't really like arguing with people all day. I don't think this is a thing for me. So I think she'd be like, also, what the heck is a behavioral science expert?
She might be confused by your job title. It might not
Yeah,
have existed back then.
as is
Um,
my whole family.
yeah. It took a really long time. I mean, health IT has been relatively new as far as like careers go. And I have to say that even for the first like 5 to 7 years of me being in this industry, like nobody in my family understood what I was doing.
Holidays are coming up, so I'm sure I'm gonna get the same old. And sometimes they're like, "Do you work on apps?" And I'm like, "Sure, Uncle Ted, I
Yes.
do. Whatever is easier." My dad, every time I meet up with him, so what do I tell my friends that you do for work? And I was home one time with my gram, and we were actually I was home because I was helping her. Talk, thinking of all the healthcare, and she had to do a Zoom call for a healthcare visit. So I'd gone home with her to do it with her. And then afterwards, I was on a work call talking about IVR, and I had it on speaker because she was like, I really want to hear what this is like. And it was just too funny because she afterwards was like, so, is this kind of what you do? And it's kind of like when I get a CVS phone call sometimes. And it was just the cutest thing of her like really trying to understand it. And then I hear from other family members that she's off telling people that I make CVS phone calls. So it's it's funny.
Well, I definitely think that the pandemic has shifted people's understanding of online meetings, right? And
Mm,
like what can happen, and especially with doctor's visits. Like a lot of I remember at the beginning having to teach my mom how to use Zoom.
mm.
And so, I mean, and now it's not a thing. Now enough time has passed, and she's just like, "Yep, I'm on it. I got it. Let me open up, create a new meeting or whatever." So interesting, like the changes that people have made over the last couple years. Um, Question about what you would say to 23-year-old Eden. Would you give her any advice as she's like starting her career journey?
Yeah, I think that I was a bit of a perfectionist back then. I'm trying to remember myself trying to get straight A's and really focus on all that. I think I would say okay to mess up and explore this. I think we always just people in general. You can kind of like try one thing and you really try to make it work, and it might not be what like brings you joy. And I think so as much as possible, like getting more and more experience and like, to like see all like there's just so much out there. And it's real easy to sort of, just work towards a goal without actually actually doing it. And then I think you can mess up because you work towards it. And that's kind of what happened with my undergrad is, work towards it. And then I didn't really know what it was until I was doing it. And I was like, oh, this isn't me. This doesn't, and now, as I explored more of, my network, and I really love living on LinkedIn and learning from people. Like that was really how I found out about public health and behavioral science. And so I think it's just, yeah, just like explore things and ask people for, advice or things like that's just really helpful.
Well, how long did it take? So, how long had you been studying or going down a path before you had actually tried out kind of living what that career was going to be like? Was there a big gap between those two?
So yeah, and I would say it's probably a lot to do with like how our systems are set up. You go off at 18 and you're like, yeah, I want to be a therapist. And you're like, I have no idea what that looks like. I've seen it on like an episode of I don't know, Grey's Anatomy or so, you've seen some kind of version of it. And I up until my senior year, where I had to do a internship, I had no actual hands-on experience. And that's when I was like, okay, like this is really great, but I was just crying a lot. So I was like, I knew wanted to help people, but it was just too close for me. So I was like, I have to go a little bit more macro level. And I think that is like now I got on a career panel the other day with students, and I was just like, go, if you're not doing an internship right now, just go and get one, because, or, anything, even if it's just like one day a week or even just doing the thing that you think you want to do, just to feel it out. It can be really hard. Oh, maybe that's not, and all of what I've learned has helped me to where I am now, but it was definitely a change from where I thought I'd be.
I know for me, I didn't know what I wanted to do. So having that advice of like trying things out and just seeing throwing a bunch of things at the wall and seeing what sticks and feeling like, oh, you learn a little bit from this and a little bit from that. And eventually it all gets kind of sewn together to, make a nice tapestry of your career. But, I wasn't one of those people that knew at 18 what I wanted to do and was like, oh, here's the path that you take. And that can be a little bit scary, but at the same time, it's also exciting.
Yeah, definitely. And I just feel like, all the things you see about, things that aren't jobs now or that will be in 10 years, and so many jobs aren't created yet that will be jobs. And it's wild to think of. I mean, I think there's so much innovation happening, and we're in a time right now where you really can be like sort of creative in what your job is, especially now that everything's becoming remote. You're not sort of isolated to where you are. I think that's amazing for people that might be in a more isolated area to be able to have all that potential. So I think there was, obviously so much bad from COVID, but I try to also find a little, silver
Yeah.
lining here and there.
Yeah, I mean, there have definitely been good things that have come from this time. It's still a little bit crazy, but yes, some good things have come from it. Is there anything that you're particularly excited about, or with mPulse or personally, that you think that is worth sharing?
I think with mPulse, what's really great is we're working on more of our sort of core solution offerings and making sure that we're really baking in the behavioral science and all the theory and whatnot into the communications. And I think that sometimes when folks think of that, they're like, oh, is that overly complicated? And it really can come down to just like a few well placed pieces of content. And so I feel like that's been really exciting on my end, is just seeing some of the things that I like that I've shared and we work on as a team. We have a new thing called Improv Studio, and it's our weekly like learning brainstorming session that I typically lead, and I'll present new research and new behavioral science topics because not everyone's background is different, but it allows for us to all come together and really think on a topic, and have all those different perspectives and sort of have a bit of a like design studio, like brainstorm jam where everyone can get creative, and then we can see how those ideas start to come to life in our work. So I really love that creative collaborative process that's happening.
That sounds like a fun weekly activity that gives you an outlet for all of the geeking out that you need to do, and then you can get and have like fun, smart, intellectual conversation around like how do you apply it.
Yeah, it's so great. I in the beginning we joked actually about wearing our silly hats during it, because I really wanted it to be something that the team looked forward to. And I've been with the company about 5 months now, and prior to this I was at another very similar company doing very similar stuff, but on phone calls, IVR sort of setup. But it's very important to me, as everyone's working from home, to like build still that community aspect, especially on a team that's really supposed to be about collaboration. So I talked about having silly hats, and now it's something that no one's let up on. So every week people will joke and come in with different hats, and a lot of my coworkers have their children, and they'll come in with like silly hats from their kids' toy closet or whatnot, and like a crown. And it's really great, because I think it just sort of speaks to the like creative silliness and like just imagination that we want for the session. We don't want it to be like this serious thing.
I love it. I'm thinking about like my collection of hats right now. I'm like, oh, that would be so much fun.
I should have told us to wear one today.
Yeah, I would have been happy to. I have like an elf hat with the ears, and it's like, that's really fun.
I love that.
Well, Eden, thank you so much. If people want to work with you or connect with you or follow you, where would you direct them? Where's the best place for them to connect?
Yeah, I like live on LinkedIn. I get made fun of pretty often because I'm up before sunrise, typically posting on there. It's like if I can't sleep, I'm online reading articles, sharing articles. So yeah, I'd say LinkedIn, and it's Eden Brownell, and I will be happy to connect with anyone.
Awesome. I will include that in the show notes. So thank you very much for your time today. This was a lot of fun.
Yeah, thank you.